Hey there, welcome back to the channel. I'm Dr. Sophia, and today we need to have a very important conversation, one that could honestly save your life or the life of someone you love. Now, before I get into it, I want you to think about something for a moment. What if I told you that the blood pressure number your doctor has been telling you to aim for might not actually be the best number for you? What if I told you that for years, millions of older adults have been given blood pressure targets that were either too aggressive or not aggressive enough, and that this confusion has led to real consequences? Things like falls, fainting, kidney damage, and yes, even heart attacks and strokes that could have been prevented. That would be pretty alarming, right? Well, stick with me through this entire video because I'm going to walk you through everything you need to know about blood pressure as you age. I'm going to break down what the latest research actually says. I'm going to explain why the old guidelines were changed. And most importantly, I'm going to help you understand what your blood pressure target should really be based on your unique situation. This is not going to be some generic video where I just throw numbers at you. We're going to go deep, and by the end of this, you're going to walk away with a level of understanding that most people simply don't have. So if you're over 50 or if you have a parent or a loved one who is, do me a favor and hit that subscribe button right now, tap the notification bell, and let's get into this because this information truly matters. All right, so let's start with the basics because I think it's really important that we're all on the same page before we dive into the more nuanced stuff. Blood pressure is simply the force that your blood exerts against the walls of your arteries as your heart pumps it throughout your body. You've got two numbers, right? The top number, which is your systolic pressure, and the bottom number, which is your diastolic pressure. The systolic number tells you the pressure in your arteries when your heart is actively beating and pushing blood out. The diastolic number tells you the pressure when your heart is resting between beats. Now, for a long time, the gold standard, the number that everybody was told to aim for, was 120/80. That was considered the textbook perfect blood pressure. And for younger, healthy adults, that number still holds up pretty well. But here's where things get really interesting, and where a lot of confusion starts to creep in. As you get older, your body changes. Your arteries naturally become stiffer. They lose some of their elasticity. The walls of your blood vessels thicken over time. And because of these changes, your blood pressure tends to naturally go up as you age. This is not necessarily a sign that something is terribly wrong. It's a normal part of aging to some degree, but the question is, how much of an increase is acceptable? How much is too much? And what number should you actually be targeting if you're 60, 70, or 80 years old? That's the million-dollar question, and I'm going to tell you the answer has changed quite a bit over the years. Let me take you back a little bit so you can understand how we got to where we are today. For decades, the medical community operated under a pretty simple framework. If your blood pressure was above 140/90, you had hypertension and you needed treatment. That was the cutoff, 140/90. And for older adults, many doctors were actually even more lenient than that. There was a time when it was considered perfectly acceptable for a 70-year-old to have a systolic blood pressure of 150 or even 160. The thinking was, well, they're older, their arteries are stiffer, they need that higher pressure to push blood to their vital organs, especially the brain and the kidneys. And there was some logic to that. It made sense on the surface. But then the research started to evolve, and we began to see that this lenient approach was actually costing lives. We started seeing that older adults with systolic pressures in the 140s and 150s were having significantly more strokes, more heart attacks, more cases of heart failure, and more cognitive decline compared to those with lower numbers. And that's when the medical community started to rethink everything. Now, the big game changer came in 2015 with a landmark study called the SPRINT trial. SPRINT stands for Systolic Blood Pressure Intervention Trial. And this was a massive study. We're talking about over 9,000 participants, many of whom were over the age of 75. And what the SPRINT trial did was compare two different blood pressure targets. One group was treated to the standard target of less than 140 systolic. The other group was treated to a much more aggressive target of less than 120 systolic. And the results were honestly pretty remarkable. The group that was treated to the lower target, the less than 120 group, had a 25% lower risk of major cardiovascular events. That includes heart attacks, strokes, and heart failure. and they had a 27% lower risk of death from any cause. Those are significant numbers. Those are not small differences. That's a meaningful reduction in serious, life-threatening events. And this benefit was seen across age groups, including in adults over 75. So the SPRINT trial basically told us that lower is better, even in older adults, even in people who we previously thought needed higher blood pressure to function properly. Now, as a result of the SPRINT trial and other supporting research, the American College of Cardiology and the American Heart Association updated their guidelines in 2017, and these new guidelines lowered the threshold for what's considered hypertension. Under the new guidelines, normal blood pressure is still less than 120/80. Elevated blood pressure is systolic between 120 and 129, with diastolic less than 80. Stage 1 hypertension is systolic between 130 and 139, or diastolic between 80 and 89. And stage 2 hypertension is systolic 140 or higher, or diastolic 90 or higher. So essentially, what used to be considered prehypertension or even normal is now classified as elevated or stage 1 hypertension. And the treatment target for most adults, including many older adults, became less than 130/80. That was a significant shift from the old 140/90 target. And for some patients, particularly those at high cardiovascular risk, the target was pushed even lower, closer to that 120 systolic mark that the SPRINT trial showed was beneficial. But here's the thing, and this is where I need you to really pay attention, because this is the part that most videos on this topic completely miss. The SPRINT trial, as groundbreaking as it was, had some important limitations and caveats that you need to understand. First of all, the way blood pressure was measured in the SPRINT trial was different from how blood pressure is typically measured in your doctor's office. In the SPRINT trial, they used a method called automated office blood pressure measurement. What this means is that the patient sat quietly in a room alone for 5 minutes, and then an automated machine took 3 blood pressure readings without a healthcare provider in the room. This is important because when you go to your doctor's office, you're often rushed. You might be a little anxious. You might have just walked in from outside, and there's usually a nurse or a doctor standing right there while your blood pressure is being taken. All of these factors can artificially inflate your blood pressure reading by 5 to 15 points or even more. This phenomenon is called white coat hypertension, and it's incredibly common, especially in older adults. So when the SPRINT trial set a target of less than 120, that 120 was measured under ideal controlled conditions. If you took that same person and measured their blood pressure in a typical doctor's office with all the usual hustle and bustle, their reading might come back as 130 or 135. So the 120 in the SPRINT trial might actually correspond to about 130 or 135 in real-world clinical practice. This is a critical distinction that a lot of people don't understand, and it can lead to overt treatment if your doctor is aggressively trying to get your office blood pressure down to 120 when it's being measured in a way that naturally reads higher. The second thing you need to understand is that the SPRINT trial excluded certain populations. It did not include people with diabetes. It did not include people who had a prior stroke. It did not include people living in nursing homes or those who were very frail. So the results of the SPRINT trial don't necessarily apply to everyone. If you have diabetes, your blood pressure management may need to be approached differently. If you've had a prior stroke, the target might be different. And if you're frail or have multiple chronic conditions, aggressive blood pressure lowering could actually do more harm than good. And this brings me to what I think is the most important point in this entire video. And I really need you to hear me on this. There is no single best blood pressure number for all older adults. I know that's not the simple answer you were hoping for, but it's the truth. The best blood pressure for you depends on your overall health, your medical history, your functional status, and your ability to tolerate medications without significant side effects. Let me explain what I mean by that. When we lower blood pressure with medications, there are always potential side effects. Dizziness is a big one, especially when standing up quickly. This is called orthostatic hypotension, and it's particularly dangerous in older adults because it can lead to falls. Falls in older adults are not trivial events. A fall in a 70 or 80-year-old can result in a hip fracture, a head injury, hospitalization, loss of independence, and in many cases, it can be the beginning of a downward spiral that leads to death. I'm not saying that to scare you. I'm saying it because it's the reality. Falls are one of the leading causes of injury and death in adults over 65. So, if we're aggressively lowering your blood pressure to hit some arbitrary target, and in the process, we're making you dizzy and causing you to fall, we're not actually helping you. We might be reducing your risk of a heart attack or stroke on paper, but we're increasing your risk of a catastrophic fall that could be just as deadly. This is the balancing act that good medicine requires, and unfortunately, it's a balancing act that doesn't always get the attention it deserves. Now, let me talk about what happens on the other end of the spectrum, because undertreating high blood pressure is just as dangerous, if not more so. High blood pressure is called the silent killer for a reason. Most people with high blood pressure feel absolutely fine. They have no symptoms. They feel no pain. They go about their daily lives completely unaware that inside their body, the excessive pressure is quietly damaging their blood vessels, their heart, their kidneys, their eyes, and their brain. Over time, this damage accumulates. The walls of the arteries become thickened and damaged. Plaque builds up more easily. The heart has to work harder to pump against the increased resistance, and eventually the heart muscle begins to enlarge and weaken. The kidneys, which are incredibly sensitive to blood pressure, begin to lose their filtering ability, and the small blood vessels in the brain can become weakened and prone to rupture, which is what happens in a hemorrhagic stroke, or they can become narrowed and blocked, which is what happens in an ischemic stroke. All of this can happen over years and decades without you feeling a thing until one day something catastrophic happens. So letting your blood pressure run high just because you feel fine or because you don't want to take medication is a gamble that I strongly advise against. So what's the practical takeaway here? What should you actually be doing? Well, let me give you my honest, evidence-based recommendations as a physician who has treated thousands of patients with blood pressure issues over the years. For most adults over the age of 65, the goal should be a systolic blood pressure of less than 130 measured properly. And I want to emphasize that measured properly part. That means sitting quietly for at least 5 minutes before the reading is taken. It means having your arms supported at heart level. It means using an appropriately sized cuff. It means not talking during the measurement. It means not having a full bladder. It means not having just consumed caffeine or exercised. These things all matter, and they can significantly affect your reading. If your blood pressure is being measured properly and consistently, then less than 130 systolic is a good target for most older adults. But, and this is a big but, if you're over 80, if you're frail, if you have a history of falls, if you experience dizziness or lightheadedness with your current medications, or if you have other significant health conditions, then the target might need to be adjusted. For some of these individuals, a systolic target of 130 to 140 might be more appropriate. The key is to work with your doctor to find the right target for you, taking into account the full picture of your health, not just your blood pressure numbers in isolation. I also want to talk about something that often gets overlooked in these discussions, and that's diastolic blood pressure. In older adults, as you age, something interesting happens to your blood pressure pattern. Your systolic pressure tends to go up, but your diastolic pressure can actually start to go down. This creates what we call a widened pulse pressure, which is the difference between your systolic and diastolic numbers. A widened pulse pressure is itself a risk factor for cardiovascular disease. But here's the tricky part. When we treat high systolic pressure with medication, we inevitably also lower the diastolic pressure. And if the diastolic pressure drops too low, below about 60, that can be problematic. Very low diastolic pressure can compromise blood flow to the coronary arteries, which receive most of their blood supply during diastole, the resting phase of the heartbeat. So, if you're an older adult and your systolic pressure is, say, 150 and your diastolic is already 65, and we start adding medications to bring your systolic down to 130, your diastolic might drop down to 50 or even lower. And that could potentially increase your risk of a heart attack even as we're reducing your stroke risk. Again, this is the complexity of managing blood pressure in older adults. It's not as simple as just picking a number and medicating you until you hit it. It requires nuance, careful monitoring, and individualized decision-making. Now, let me share some practical lifestyle tips that can help you manage your blood pressure naturally, because medication is only one piece of the puzzle. And in some cases, lifestyle changes can be just as effective as drugs. The first and probably most impactful thing you can do is reduce your sodium intake. I know you've heard this before, but I cannot overemphasize how important it is, especially for older adults. As you age, your kidneys become less efficient at excreting sodium, which means that dietary sodium has a bigger impact on your blood pressure. The current recommendation is to consume less than 2,300 milligrams of sodium per day. But for older adults and those with hypertension, less than 1,500 milligrams per day is ideal. And I'll tell you, most people have no idea how much sodium they're actually consuming. It's not just about the salt shaker on your table. It's the processed foods, the canned soups, the deli meats, the restaurant meals, the bread, the cheese. Sodium is everywhere in the modern diet, and it adds up quickly. Start reading labels, start cooking more meals at home, start using herbs and spices instead of salt for flavoring. These small changes can make a tremendous difference. The second thing is regular physical activity. And before you tell me that you're too old to exercise, let me stop you right there. You are never too old to move your body. Now, I'm not saying you need to run marathons or lift heavy weights, but regular, moderate activity like walking, swimming, cycling, or even light resistance training can lower your systolic blood pressure by 5 to 8 points. That's as much as some medications. Aim for at least 150 minutes of moderate intensity activity per week. That's just 30 minutes a day, 5 days a week. And if you can't do 30 minutes at once, break it up into 3 10-minute sessions throughout the day. Every bit counts. The third thing is maintaining a healthy weight. Excess body weight, especially around the midsection, puts additional strain on your heart and blood vessels and drives up blood pressure. Even a modest weight loss of 5 to 10% of your body weight can significantly reduce blood pressure. You don't need to become a fitness model. You just need to move in the right direction. The fourth thing is managing stress. Chronic stress keeps your body in a constant state of fight or flight, which elevates your blood pressure over time. Find what helps you decompress. Whether it's meditation, deep breathing exercises, spending time in nature, reading, gardening, listening to music, whatever works for you. Make it a regular part of your routine, not just something you do occasionally when you feel overwhelmed. The fifth thing, and this one surprises a lot of people, is getting good quality sleep. Poor sleep, and especially conditions like sleep apnea, can significantly raise blood pressure. If you snore loudly, if you wake up feeling unrefreshed, if you feel excessively sleepy during the day, talk to your doctor about getting a sleep study. Treating sleep apnea alone can sometimes bring blood pressure down by 10 points or more. And the sixth thing is moderating alcohol consumption. A drink or two per day might not be a big deal for most people, but excessive alcohol intake is a well-established risk factor for hypertension. If you drink, keep it moderate. And if you don't drink, don't start thinking it'll help your health. The latest research is actually showing that the supposed heart benefits of moderate drinking have been overstated. Now, before I wrap up, I want to address one more thing that I think is really important, and that's the issue of home blood pressure monitoring. I am a huge advocate for home blood pressure monitoring, especially for older adults. Here's why. Your blood pressure fluctuates throughout the day. It can be affected by stress, activity, meals, medications, and dozens of other factors. A single reading in your doctor's office gives you a snapshot, one moment in time, but it doesn't tell you what your blood pressure is doing the other 23 hours and 50 minutes of the day. By monitoring your blood pressure at home, you get a much more complete and accurate picture. You can identify patterns. You can see how your blood pressure responds to your medications. You can catch problems early. And perhaps most importantly, you can avoid the white coat effect that can lead to unnecessary medication changes. When you monitor at home, use a validated automatic upper arm cuff, not a wrist monitor. Measure your blood pressure at the same times each day, ideally in the morning before taking your medications and in the evening. Take 2 to 3 readings each time, about 1 minute apart, and record them. Bring your log to your doctor's appointments. This information is incredibly valuable and can help your doctor make much better treatment decisions. If you have concerns about accuracy, bring your home monitor to your doctor's office and compare its readings with the office measurement. They should be within about 5 points of each other. If they're not, you may need a different monitor. All right, so let me bring this all together for you, because I've given you a lot of information and I want to make sure the key messages are crystal clear. The best blood pressure for older adults is not one single number that applies to everyone. For most older adults who are otherwise fairly healthy, a systolic blood pressure of less than 130 is a reasonable and well-supported target. For those who are very elderly, frail, prone to falls, or have multiple coexisting medical conditions, a slightly higher target of 130 to 140 may be more appropriate to avoid the risks associated with overt treatment. The diastolic pressure should generally not be driven below 60, especially in older adults with known coronary artery disease. Blood pressure should be measured properly and consistently, ideally with home monitoring in addition to office visits. And lifestyle measures including sodium reduction, regular physical activity, weight management, stress reduction, quality sleep, and moderate alcohol intake should be the foundation of blood pressure management, with medications added as needed to achieve the target. Most importantly, this is a conversation you need to have with your own doctor. Every person is different. Your blood pressure target should be personalized based on your complete medical picture, not based on a generic guideline or a number you read on the internet or even a number you heard in this video. Use the information I've given you today to have a more informed, more productive conversation with your healthcare provider. Ask questions, understand why a particular target has been chosen for you, make sure the benefits of treatment outweigh the risks. That's what good individualized medicine looks like. I hope this video has been helpful. I hope it's given you a deeper understanding of blood pressure management in older adults and cleared up some of the confusion that exists around this topic. If you found this valuable, please give it a thumbs up, share it with someone who needs to hear this information, and subscribe to the channel if you haven't already. I put out new videos regularly on topics just like this, topics that can truly make a difference in your health and your quality of life. I'm Dr. Sophia, and I'll see you in the next one. Take care of yourselves and take care of each.